Distinguishing inferences and beliefs, a challenging skill in REBT. In Rational Emotive Behavior Therapy, there is the foundational ABC model. The A stands for activating event, or more specifically, the critical activating event, which is that aspect of a situation or event most related to the emotional or behavioral disturbance that a client has experienced and is under consideration within a therapy session. The C stands for consequences, which refers to the emotions and behaviors that are associated with, not caused, but are associated with the critical activating event. The B stands for belief. However, more correctly, the B should stand for cognition, because in REBT we consider two types of cognitions, and they are inferences and beliefs. The B in the ABC model stands for beliefs because REBT tends to focus much more on beliefs than inferences. However, it is very important for an REBT therapist to know how to distinguish inferences from beliefs, because these two types of cognition serve two very distinct and important functions. Good REBT therapists identify early in therapy both inferences and beliefs that a client holds about particular events and situations, or in other words, the critical activating event. Therefore, in this video, I will attempt to distinguish inferences and beliefs and demonstrate how each is relevant in a therapy session. First, never forget that inferences and beliefs are both types of thoughts or cognitions. Both are thoughts about critical activating events experienced by a client. Inferences are those thoughts that interpret or attribute meaning to the critical activating event. For example, if a client was just diagnosed with cancer, a possible inference might be, "I might die from this," or "the treatment for this cancer could be long and impact my daily living." Notice that both these thoughts or inferences interpret the meaning of the diagnosis of cancer for this client. Other clients might have other inferences, such as, "This is a surprise. I wasn't even remotely expecting this diagnosis," or, "Well, this type of cancer runs in my family." Notice that these inferences don't evaluate having the cancer diagnosis. They just interpret the meaning of the diagnosis. The inferences don't indicate whether the client thinks the diagnosis is good or bad, horrible or tolerable, makes the world an awful place, that they can't stand having cancer, that they shouldn't have gotten cancer, or that life with cancer will be intolerable. Beliefs serve an entirely different function from inferences. Whereas inferences are interpretations or attributions of meaning to a critical activating event, beliefs don't interpret the event or situation, they evaluate it. Evaluating an event means that we think that the event is good, bad, horrible, tolerable, intolerable, unbearable, awful, a catastrophe, should or should not have occurred, must or must not have taken place, ought to have happened or ought to have happened, needed or not needed, and so forth. Notice that beliefs, since they are evaluations of events or situations, go beyond interpreting the meaning of the event to actually evaluating the event. Let's use the situation in which a client has just learned that the client has been diagnosed with cancer. We have covered some of the possible inferences. Now let's consider some of the possible beliefs. Examples are, "I should not have gotten cancer. This diagnosis is horrible. Having cancer is a catastrophe. I can't stand the thought of having cancer. Having cancer will make my life unlivable. The world is a horrible place now that I have cancer," and so forth. The important thing to remember is that beliefs evaluate activating events rather than interpret them. How are inferences and beliefs related to each other? I like to say that these two cognitions function as follows. The inference sets the stage for a client experiencing emotions and exhibiting behaviors, but it is the belief that largely causes the emotion or behavior. This is proven by the fact that a single inference may be associated with multiple beliefs, and for each of the beliefs based on the same inference, the client's emotions and behaviors would be different. An example might make this clearer. Consider a client who has just been fired from the client's job. There are multiple possible inferences the client might hold, but let's say this client's inference for this particular event is, I will never find a job as good as the job I just lost. That is the meaning the client is giving to getting fired from this job. Now, let's consider different possible beliefs a client might hold while holding this same inference. Belief: I shouldn't have been fired. Possible emotions and behaviors: the client might experience any of a number of emotions, such as depression, anger, anxiety, etc. Possible behaviors might be yelling, screaming, avoid searching for a new job, withdraw from doing important things such as eating well, taking prescribed medications, or exercising. Belief: my boss is a total jerk for firing me. Possible emotion and behavior: anger or rage accompanied by yelling, threatening the boss, taking anger out on the client's spouse. Belief: life without this job is horrible and meaningless. Possible emotions and behaviors: depression and withdrawing from doing things that normally brought enjoyment and meaning. Belief: I am such a loser for getting fired. Possible emotions and behaviors: depression, guilt, shame, and withdrawing from other people, spending a lot of time thinking of all the stupid things the client has done in the past, and so forth. So, we can clearly see that the inference the client holds about getting fired is not what caused any emotion or behavior. It is the belief held that causes the emotions and behaviors. The inference is important because without the inference, there would be no beliefs. The inference sets the stage for the emotional and behavioral disturbance, but it does not cause the disturbance. So, if the beliefs are what largely cause the emotions and behaviors, why should a therapist even bother with helping a client identify the inferences held by the client about a particular activating event? It is simple. If a client tends to hold inferences that aren't true or not helpful in many different situations in life, there is a greater tendency that the client will set the stage for a larger number of dysfunctional emotions and behaviors. For example, if a client believes that a bad event such as getting fired tends to yield negative outcomes such as not being able to get a job that is just as good, then they set themselves up to experience a wider array of possible unhelpful negative emotions such as depression, anxiety, rage, hurt, jealousy, envy, guilt, shame, and so forth. For example, if the client in this example holds a similarly structured inference in different domains of life, such as occupation, education, interpersonal relations, spiritual, recreational, etc., then multiple domains of life would be negatively impacted. For example, if the client gets a failing grade on an exam and believes that they will never be able to pass the course, the client has set the stage for possible unhelpful negative emotions. If the client experiences a negative event in church and believes they will never be able to find another church that is as good as this church, then they set the stage for possible unhelpful negative emotions and behaviors. If the client has a friend that lies to them and they believe that they will never be able to trust friends again, then again, they set the stage for unhelpful emotions and behaviors. So, it is very important for a therapist or counselor to not only identify inferences held by a client about a particular activating event, but a bit later in the therapy, the therapist should consider whether the client tends to hold similar such inferences in multiple domains of life and thereby set the stage for emotional and behavioral disturbances about many events and situations in life. I hope this video has helped you to understand the differences between inferences and beliefs and the importance of identifying them when working with a client. We tend not to distinguish inferences and beliefs in our everyday life, so this is a skill you will need to learn, and that may take some time. Be good to yourself and try not to disturb yourself or get overly frustrated if you don't get it right away. Disturbing yourself or getting frustrated, while totally normal, simply isn't helpful and will make it more difficult for you to learn it. Have questions? Contact your professor who is dedicated to helping you learn this concept and acquire this skill among others you will encounter in this course. All the best.